All right, hello everybody. Happy Halloween. We're here with group 8. Oh, the 8. I spaced it already. Group 8.
Yeah.
Anyway, Department of Health and Human Services, and they're going to start sharing with you now. So I'll go ahead and turn the time over. So here you go. Go ahead and take it away.
The U.S. Department of Health and Human Services. McKenna Wade, Gabriel, Neil, Chris Richardson, Nicole Dobson. How do you switch slides on here?
Say next slide.
Next
You
slide.
just let me know.
So their mission statement is the mission of the U.S. Department of Health and Human Services is to enhance the health and well-being of Americans by providing for effective health and human services and by fostering sound, sustained advances in sciences underlying medicine, public health, and social services. Next slide, please. So this is basically just a chart for the organizational structure. Just kind of all the divisions that are in there. It has 11 operating service and 3 human service agencies. These divisions administer a wide variety of health and human services and conduct life-saving research for the nation, protecting and serving all Americans. As you can see, there's kind of 2 breakups in the organization. You have like the Office of the Secretary. That's like a lot of financial stuff, planning, just kind of administrative stuff, and just kind of in general, plan and evaluation. Well, the next one is like the operating division. So you have like the Food and Drug Administration, you have health for like the Indian services. So it's like, again, as it says, they're just like for the human service agencies that kind of hit the large demographic of Americans. Next slide, please.
All right, so the basic functions of the HHS, the U.S. Department of Health and Human Services, there are a lot of them, and usually I don't put a lot of words on a slide, but I did this on purpose just because there are so many functions and so many services that the HHS offers, and they offer all these functions and services through their programs and their partners. So the very first one being Medicare, Medicaid, the CMS program. We won't go too much into that because that's Group 8's project. But basically, the whole health insurance marketplace they're over. They also promote patient safety and health care quality. Basically, they do this by looking after the healthcare setting. So, for example, the providers in hospitals and family practice clinics and walk-in clinics, they want to look over the safety and effectiveness and quality and the security of these areas to keep people safe. They also work to eliminate health disparities where they work to eliminate health disparities. And they do this by protecting the vulnerable individuals in the communities, such as the people who are impoverished, people who are elderly and the young, and those who are disabled. They also conduct public health and social science research. They improve maternal and infant health through programs such as WIC, along with other developmental stages during a person's life. And they promote economic and social well-being. They support wellness efforts to prevent risky behaviors, such as the public health aspect of it, where it's like smoking cessation classes, teen pregnancy awareness, drug use awareness, things of that nature. And they prevent and track and manage the impacts of infectious diseases, where the CDC comes in. We'll talk more about the CDC later in our presentation. And most of all, they prepare, they protect, and they provide us with responses to health, safety, and security threats. So they're really just looking over the entire health status of the United States. Next slide, please. And the reason why I have this on here is just to represent that the HHS, or the U.S. Department of Health and Human Services, is pretty much the all-seeing eye over the entire United States healthcare industry and well-being. Next slide.
All right, so we have some principal players, and I started off with the HHS secretary, and Sylvia Burwell, she is the main person. She oversees all of the employees, 77,000 plus employees. And she operates under 3 guiding tenets or beliefs, philosophies, and those are deliver results on a wide range of complex issues, strengthen the relationships that drive progress, and build strong teams with the talent and focus needed to deliver impact for the American people. Now, her experience, these next 4 people we're talking about have tons of experience. It was really hard to break down exactly what, but so she served as director of the Office Management and Budget. She worked as chief of staff. She worked with the Gates Foundation, and she also was president of the Walmart Foundation. So she has lots of experience to bring to her position. All right, next slide. Or do I do that? All right, thank you. Daniel Levinson, Inspector General. So he works at the Office of Inspector General, or the OIG. And he has many employees under him, about 1,700, and they oversee the integrity and efficiency of the nation's federal health and human services program. He also oversees Centers for Medicare and Medicaid, Administration for Children and Families, Center for Disease Control and Prevention, Food and Drug Administration, and National Institute of Health. He also has a lot of experience. He was a member of the Government Accountability and Transparency Board, member of the Recovery Act Accountability, Deputy General Counsel of the U.S. Office of Personnel Management. And I can't see number 4, but okay, next slide. All right, this is Andrea Palm, and she is the senior counselor to the secretary. She works as part of the team under the secretary, and she has helped with many different things. She helped with the H1N1. She strengthens the FDA's oversight of compounding pharmacies, works with food safety, the Affordable Care Act, and she brings a lot of experience. She previously worked as a chief of staff at HHS prior to becoming the senior counselor to the secretary. All right, next slide. And Mary Wakefield, she is the acting HHS deputy secretary, and she oversees a lot of operations within the department: Medicare, Medicaid, public health, medical research, food and drug, welfare, children and family safety, and et cetera. She has also a lot of experience. She oversaw approximately 1,100 federally supported community care clinics that serve people without health insurance or the underinsured. She was also a professor for health policy research and ethics at George Mason University, and the director of the Center for Rural Health of School of Medicine and Health Sciences. All right.
So I think it's my slide next, yeah.
Yes, your slide next.
Okay, so my slides are talking about the relationship between the CDC, which is the Center for Disease Control and Prevention, and the HHS, the Department of Health and Human Services. I just kind of talked about how the CDC is a major component of the Department of Health and Human Services. They work all day and all day, every day to protect the people in America from all forms of threatening diseases, and encourages the communities and the citizens to do the same. They are here to help the country by protecting their health and safety, by preventing disease, injury, or disability, by staying up to date on all of their studies that they do. They accomplish their mission to save lives from health threats. The CDC conducts critical science and provides health information for the nation, and will respond if any threats come up, which I'm sure there definitely has been many. Okay, next slide. So to kind of continue, the Department of Health and Human Services has been working with the CDC to keep the country safe from the threats involving health. They have been putting their focuses on health security in many ways, and here's a little list of them. They confront global disease threats through advanced technology in the labs and use the data that they get for solutions. They turn their science data into actions through tracking diseases and finding out certain preventions for them. Improving medical care through newfound knowledge and spreading to individuals and communities to save more lives. So I feel like that's a big one too, is, you know, they're not just doing all the work, they're also, you know, spreading it to the communities so that we can do our part to help keep the country safe. They fight the diseases before they even get there, get through detection and by confronting the germs and the diseases around the world. So they're doing a lot of studies around the world to, you know, before they even get into America, or they're working towards that to help prevent anything from coming through. And then the last one I have is by improving the health system through strong public leaders at all levels to make sure that things get done, and that the American people are healthy and safe. So yeah. Okay, next slide, I guess. So here's just a few of our references. We all pretty much used the hhs.gov, or kind of, you know, expanded upon that. And so.
All right. Good job, everybody. What I wanted to do is, you can go ahead and unmute now if you like. I'll just ask a question or two, probably just a question. But from your research, what are some actual specific examples that the CDC has helped out with as of recent? Can you think of any specific examples?
I feel like when I was on the CDC website, I saw a lot of like the different outbreaks that they have been working on, and there's a lot of like E. coli and I don't know, things like that. And also, I'm sure with, you know, certain outbreaks of, was it like measles and things being like, you know, spread to kids that aren't immunized or.
Yeah, and then not only that, but they've also been very active in recent years, including now about, you know, just the obesity epidemic in America. I mean, there are so many programs that the CDC has. Number one, like, I mean, I'm not sure if they actually like fund it or not, but like there are programs that have come about because of studies and because of the findings that the CDC has made that have really expanded public health's ability to reach people. So they're very active in that aspect too.
Do you feel like they're effective in what they try and do then? If, you know, if we're talking about the problem with obesity in America, how are they doing that, and how well are they doing with it?
Well, I personally think they're very effective. I'm a public health major. I'm not a healthcare administration. Thank you. I'm a public health major, not healthcare administration. And so we look at, you know, CDC studies all the time. We're always looking at better ways that we can help improve people's health, which, I mean, heart disease is the #1 killer right now on the charts, so that's what we learn about all the time in school. So I think that their research is really coming forward in all the universities and helping the healthcare professionals get their point across. So I think they're being very effective in it, especially with the new programs that the government has put out about, you know, healthy children. Pretty soon we're going to have a whole new generation of kids who have been raised learning how important it is to get the right kind of nutrition, like getting the right amount of exercise daily. So I think the CDC has been very, very good at that.
I agree. I think, you know, as part of their job, they're there to help the community progress. You know, they're not there to do all of the work, you know, and so obviously, you know, there is a high obesity rate in America. And so that's true, you know, like through schools and through certain programs, they're trying to teach the kids about, you know, healthy eating and, you know, constant exercise and doing their part to stay healthy. And yeah, so I agree.
Okay, very good. I'll let you guys go. Enjoy the rest of your Halloween.
Great. Well, thank you.
You bet.
you.
Don't do too much trick-or-treating, but do some.
Of course.
Okay, thanks, everybody. Great job.
Thanks.